We go. Hello, everyone. I'm David Moore, and this is another edition of Pep Talks Uncut. We are the Pennsylvania Equality Project, and in our fight for fairness across the Commonwealth, we are meeting with and talking with a number of legislators and prospective legislators, a number of everyday people, and a number of others to get their opinions on various topics related to the LGBTQ plus community. Today in our studio, we happen to have Salem Snow. Salem, could you tell us a little bit about who you are and what you're up to?
Absolutely. My name is Salem Snow. I am 31 years old, and I am running for the U.S. House of Representatives in Pennsylvania's 2nd Congressional District. I come from a working class background. I grew up very poor, so my family struggled a lot. And that, in addition to growing up LGBTQ, kind of made me politically aware and politically active pretty early on. I volunteered for the Obama campaign when I was in college, and I volunteered for Bernie Sanders in the 2016 cycle. And in the past couple of years, I have started to see that the folks in my district, as well as across the country, really need real working class representation in Congress. So we're shooting our shot at Pennsylvania's 2nd Congressional District.
Very good. So can you describe a little bit for viewers that are not necessarily connected to Philadelphia? What is the area you'll be representing should you win? What is that like? Is it a suburban territory? Is it a gritty manufacturing? What kind of area will you represent?
So the 2nd district it's the poorest district in Pennsylvania. The average income is right around or below $20,000 a year. Our area is being aggressively and quickly gentrified, which, there's nothing wrong with new development per se. It's when that new development begins to, price out working class folks, people of color, LGBTQ people, that adds to the housing crisis that we're already experiencing, that gentrification becomes a problem. So it's very much a working poor district for the most part. It's a very diverse district. There's a decent amount of Hispanic folks, of Black folks, immigrants. It's very diverse. So, it's a district that's got a lot of really great people. It's almost exclusively working class people. It's just that these folks are struggling and they need help, and, they're really not getting the help and the resources that they need.
So back us up a step. You said back, I'm guessing it would have been the 2012 election, you were on board the Obama for President campaign when he was running against Mitt Romney. Was that your first foray into advocacy and activism, or did you have a start further back than that?
I would say I really began kind of self-educating a little bit about the political sphere when I was about 14, which would have been about 2004. The first time I briefly volunteered for the Obama campaign was actually 2008, but I was not super educated on politics at the time. I just knew that I thought he was the better candidate and he was somebody that I wanted to do some work for. So the 2008 campaign was really my very first experience with campaign work. I did volunteer for him again in 2012 with a little bit more knowledge and experience.
Okay, and did you hold any particular title when you were working for the campaign, or was it just local volunteer?
It was just local volunteer work. I was still in college during both cycles. So it was kind of just something I did for a few hours each week, just kind of getting my feet wet into the campaign world a little bit.
Okay. You mentioned having worked with the Bernie Sanders campaign. Truth be told, I did vote for Bernie at one time. I believe it was a primary a few years back. I think it was 2016. Bernie would have made an amazing President of the United States, in my opinion. He has a lot of brilliant ideas, some of which Senator Chuck Schumer has recently signed on to. For example, improving the quality of Medicare by including dental, vision, and hearing costs under the umbrella plan of Medicare. So Medicare and Medicaid are very important pieces of legislation that directly impact the LGBTQ plus community across Pennsylvania, largely because they impact, as you put it, the working poor the most. What steps would you take, should you be elected to Congress, to improve Medicare and Medicaid for the people of your district?
So the first thing we really need to do, which, you know, I think a lot of Democrats have been working towards this for years, is, you know, essentially expanding Medicaid and Medicare, which is the most basic way to put it. There's a variety of things that we need to be focusing on. My end goal personally is to have a universal healthcare system that is single payer, that covers everything that is necessary medically for folks, everything from prescription drugs, surgeries, vision, dental, anything that folks need, I believe should be covered. So with that being the end goal, I think that we do need to first focus on where we have the most support. You know, not every Democratic politician does support a single payer universal healthcare system, but the overwhelming majority of them do agree that what we have is not enough and needs to be expanded upon. So, you know, we can really just start with, you know, where we agree. Like I said, there's even Democrats who are corporate funded or even funded by, you know, the healthcare industry that still want to, you know, make expansions, maybe not as much as, you know, like I would like to see, but still, like, you know, you start with the easiest things that you can get past to help the most people the quickest, and then you build off of that.
Okay. The US Supreme Court recently weighed in within the past few weeks on the Affordable Care Act and said that the challengers to it didn't have standing to bring the case before the court. Now, my understanding from up and coming cases that are bubbling through the lower courts, some of those cases may involve litigants that do have standing. Do you think the Affordable Care Act is in any danger, any imminent danger of being stricken by the US Supreme Court, or for that matter, by any other court?
I don't, and I'll tell you why. First and foremost, I want to say that ever since the Affordable Care Act has been successfully passed, that there's been major opposition, particularly from Republicans. You know, they've really hammered on the Affordable Care Act. And, you know, to be clear, their focus is not so much the substance behind it. It's the fact that, you know, Obama put it forward and that's what they really, you know, oppose. But I don't think, you know, none of their attempts have really been successful so far. It's been, you know, struck down multiple times in the courts. I don't think the Affordable Care Act is going anywhere. I don't think Americans want it to go anywhere. I don't think the majority of politicians want it to go anywhere. And at this point, I just don't see the courts siding against it. That being said, you know, as I've stated, like I personally do prefer a single payer system. So the Affordable Care Act is not my preferred, you know, legislation involving healthcare. It's not my ideal. But obviously, as somebody who comes from a working poor background and is aiming to represent working poor people, the ACA is a vital part of healthcare for these people. And it's essentially a lifeline. It's the only thing that they have that gives them coverage, you know, any form of dental coverage, any form of, you know, requiring certain visits and medications to be covered. So I don't think it's at any real risk right now, but I don't think it's enough.
Okay. Among the various concerns that have swept across Pennsylvania, one of them is a push by current Lieutenant Governor John Fetterman to decriminalize cannabis use, and in the same breath to make it perfectly legal to use recreationally. How do you come down in terms of striking down you having cannabis listed as a Schedule I drug under the regulations from the federal government?
So first, I think, well, okay, to put this plainly, the American people, poll after poll shows that folks support the legalization and decriminalization of marijuana, whether that's medically or it's recreationally, and I am behind both. And I think that just to tie this back, I do think that this is another issue that disproportionately impacts low income people, people of color. And so in that respect, it is a class issue, a race issue, etc. So I think that it's time for us to embrace, not just what the American people want, but also what they need. Marijuana is a medicine, and it's been proven not to essentially be a gateway drug as it was once thought to be, and campaigned as or against. So statewide is a great start. There have been states that have already set the foundation for this. They've set the precedent for this, and all of them have showed success in doing so.
Mhm.
So at this point, I really see no reason not to just, federally make this a legal thing, a protected thing. Because as I said, it's, not just a medicine, but it's also something that impacts working class people and disproportionately minorities.
Full disclosure, I am one of those people who are disabled. After having fought cancer since 2008, I find the occasional cannabis nip quite relaxing, and it is a fantastic way to ease the pain. Now, having said all that, there are countries on the planet. Portugal is one that comes to mind. I think the state of Oregon is experimenting with this. The decriminalization of all street drugs. But what would happen, for example, in Portugal, is that if you are caught with a small amount of, say, meth or coke or some other drug, rather than being funneled into the criminal justice system, you're funneled into more of a rehab system. Do you think the United States is that should be the end goal, is to get people out of prisons and into rehab, or where do you come down on all that?
So first, I think that we need to eliminate the for-profit prison system, because whenever profit is going to be a motive in something like that, that's going to be the priority of the people who own and run these sort of facilities, the industry as a whole. So we really need to take profit out of the equation. We need to make it so that it is not profitable to exploit people, especially people who are suffering from addiction disease, to not exploit these people and just throw them into a prison system. And, the for-profit aspect aside, we've also seen that the US prison system is basically useless. It does not rehabilitate people. It actually makes things worse. It makes, getting started once they get out of prison worse. They have traumatic experiences while they're there. They face all sorts of abuses, negligence, and, just a very unhealthy environment overall. And if you want folks to succeed, you have to give them the tools and resources to succeed. So we need a complete overhaul of our prison system. We need a new system that focuses on rehabilitating human beings in a humane way, in an effective way. Because, like I said, we've already seen what we're doing isn't working. So there's really no need to continue to perpetuate the system. I do think that full decriminalization is a very positive step forward, if for no other reason than the fact that it stops that funneling into the prison system, and we can begin to treat this as a healthcare issue and a healthcare crisis, and not so much as a criminal issue.
Mhm. So I've often heard it said that one of the ways to reduce the consumption of drugs is to give people education, to provide education for them so that their career aspirations can be expanded. In other words, if you're going to be stuck working in a position that's menial, that's minimum wage, that's almost self-defeating, that the likelihood that you're going to turn to drugs, it simply becomes considerably more dangerous. It becomes more of a problem, an issue, because let's face it, the number of people who are poor, who are also involved with drugs and then find their way into the criminal justice system, the for-profit system that you've explained, find themselves oftentimes with weak representation in court. So that brings to mind, we've talked quite a bit today about all sorts of questions that are legally related. Do you have a background in law, or what is your background beyond going to college?
So interestingly, I was in college for about 7 years. I left in my last year to pursue a job offer that I'd gotten to work in the music industry, interestingly enough. I worked there for several years. I did things like writing, production, a lot of music-based work, until I eventually had worked my way up into doing public relations, and became the head of public and media relations at a record label. From that point, I had worked, prior to that, I had worked about like 10 years total in restaurant service, waiting tables, things like that. So after my job there got outsourced, and I went back to working in restaurants and waiting tables for a few years, and I began to kind of do public relations on my own. That was when I started kind of doing public relations in volunteer positions for local campaigns, which is how I ended up getting involved in Philly politics, was, doing public relations for other candidates. And so I don't have a background in law. Most of my viewpoints are largely from, experience, and from experience in the community, from listening to experiences from people in the community. And it's interesting because a lot of folks, a lot of politicians especially, kind of have this idea that you need a set amount of experience, you need a set amount of education, and that actually sets sort of a classist barrier for underprivileged people who are out here living these experiences. It's one thing for someone who comes from a background of privilege to kind of talk about, their perception of experiences and oppression that other groups, go through. It's another thing when you have somebody who's lived these experiences and oppression actually go forward to represent people, because it's more personal to them. They have personal experience with it. They are closer to people who have experiences with these things. And really, I think that's what we need more of in politics. That being said, I do think that we need to make education universally available. Any folks that want to pursue higher education should absolutely have that opportunity. We need public colleges. We need these resources to be available just as equally to underprivileged people as they are to folks who come from either middle class or, wealthier families.
So critics would argue that it is very expensive to pay for the college or educational needs and wants of the entire society. Bernie Sanders had a plan. What would be your vision for that? Is it in line with what Bernie suggested?
So I do agree with the points that Sanders put forward. I do think that there's, a couple different ways to go about doing this, as there, typically are.
Mhm.
The first thing that I would argue is that, the precedent for universal education has already been set by countries who are not only economically smaller than the United States, but also don't necessarily have the same resources we do. So if there are countries who can already provide this service to all of society, who don't have the same money and resources that the United States have, then there should be no logical reason that the United States can't, follow suit and, essentially do the same thing. There's several countries that have set a lot of really good social precedents that I really think the United States should be following. And that's one of them. And, as far as I always love the question that comes forward, how are we going to pay for this?
Mhm.
Just because that question, never gets asked when it comes to the United States war machine, when it comes to corporate bailouts, things of that nature. The CARES package itself, while it had some, great social aspects to it, it
Mhm.
was also largely a corporate bailout. And they had no problem spending, trillions of dollars in total into constantly bailing out these industries, these corporations, or even the Pentagon budget, which is extraordinarily high. It's several times that of the next biggest US spender, which I believe is China. So there's definitely places where, we could easily make budget cuts and, relocate our resources into social services that actually benefit taxpayers.
Well, I think you're right. I think you're absolutely right, because to be clear, the US budget, uh, of that, 57% of all the money that the United States is spending is going into the Department of Defense. The other 43% is going into other types of programs, and of that, less than 1% is going into programs like the TANF benefits or SNAP benefits, or other programs that are offering Head Start or early childhood education. And it seems to me, if we can find trillions to bail out corporations, we can find money to feed the people in this country.
Absolutely.
So there are some real firebrands in Congress right now. One of them comes to mind as Alexandria Ocasio-Cortez. Another is Ilhan Omar. Their ideas 20, 30 years ago would have been considered absolutely off the charts wild. But now that I've had a chance to listen to them and absorb them, and given the background I've come from, I 100% agree with most of what they say. The little bit that I don't probably has more to do with they aren't going far enough.
I agree.
So yeah, that's where I come down. Do you see yourself in the same image as AOC or Ilhan Omar?
So I do think that they have set a very important precedent as far as elected officials in the United States, particularly in Congress. I agree with a large number of the policies they've put forward. I sometimes, disagree with, tactics or, small things here and there, which I really think is mostly negligible to the big picture. I think I have more in common with them than I would say differences. Um, to kind of like go back just a little bit to what you were saying, I do think my biggest criticism is that, they don't go far enough. I do think that they've opened the door for, progressives, even more aggressive progressives, so to say, to kind of like, they've opened the door and it's time for us to go down there and knock it down, The pandemic has really, in some ways, shown us what is possible. So many jobs that they said couldn't be done remotely have been done remotely, have been done from home, over the past year. The entire education system has essentially, been able to been done remotely. And last but certainly not least, the stimulus payments and the boost to unemployment, we've shown that, like, yes, the government is capable of giving out money and social services when they need to, and we are capable of restructuring society to kind of mold to the environment we've evolved into. And so there's no reason that we can't continue on that route and continue to evolve and continue to restructure society in our system, as well as continue on the precedent that we've put forward with social services during the pandemic.
Moving forward, there are a number of bills pending in both Harrisburg and in Washington, D.C. that expand equal rights for all U.S. citizens. And of course, I'm thinking of the Pennsylvania Fairness Act in Harrisburg and the Equality Act, excuse me, in Washington. And while these are both very important pieces of legislation that would end legalized discrimination, to me, in my opinion, they are not the be all end all, much like marriage equality back in 2013 and 2014. That was only one of the first big steps we were moving forward. What do you see beyond the Equality Act as the other ambitious agenda items that we should be scratching off our list?
So I think it's important, first off, to note that, like you said, these pieces of legislation do address aspects that I feel like is kind of late in the game to be addressing. Like, it's needed. I'm not saying it's not needed. I just feel like we should have done more, or Congress or, elected officials should have done more for the LGBTQ community at this point. That being said, like you got at, like, this is only the beginning. And I also think it's important to point out that the fact that it took us this long to get from, marriage equality to, hey, maybe don't discriminate against LGBTQ people is way too long. And LGBTQ issues are nuanced, they're intersectional. It's healthcare is an LGBTQ issue, education, housing. There's so many avenues where we're disproportionately impacted, and those things just aren't being addressed at all. There are a lot of cis straight people, which is, the majority of our elected officials. And while a lot of them do have, good intentions with this sort of legislation in regards to our community, they haven't lived these experiences. They don't understand the full intersectionality of, all these policies. So, like you said, like, they're important pieces of legislation that do address certain aspects, but we've got to do a lot more for our community than this.
Absolutely. According to a number of polls and surveys that I've worked with over the last 3 or 4 years, one of the key concerns with homelessness is LGBTQ youth. 40% of all the homeless population in the United States fall within the LGBTQ community. What are some steps that we can take as a nation to address homelessness, in particular for the LGBTQ plus community?
So the way I see this, the only way to truly and equitably address this issue is to ensure housing as a human right. There's no way to, we can try, they've had sort of like LGBTQ targeted like shelters and things like that. But even that doesn't go far enough, So ensuring housing as a human right is really going to be the only way to have, true housing justice. And ensuring it as a human right is something that is not only actually easily obtainable, we very much have the resources to address this. And, again, other countries have set the precedent for universal housing. So there's no reason that we can't do this. But housing justice, universal housing would ensure that all LGBTQ people have safe, green, adequate housing. And the same would be true for people of color and other marginalized communities who have been disproportionately impacted by that. So I think that housing as a human right is really the only viable way forward to adequately addressing that issue.
So going along with providing adequate housing is providing adequate income. During the COVID-19 pandemic, a number of senators, Ron Wyden comes to mind as one of them, wanted to put forward or did put forward legislation that would have provided a basic income of $2,000 per person for everybody making under a certain income amount. Finland has been doing this already long before COVID-19. Should the United States follow suit?
100%. And like I said, like, with the stimulus payments itself, the United States has shown that it is more than capable of, following suit. And that also comes down to, fair wages in itself. Folks in the current economy and the current state of things, people need money to survive. And money is essentially a resource and it's a lifeline. And if money is what we're going to treat as, the lifeline and the resource that you need to survive, well, then we need to make sure that everybody has this. We need to make sure that, it's distributed in a way that makes sense, that sustains life, that improves quality of life. So ongoing stimulus payments is absolutely something that should be done. One of my criticisms about the child tax credit was that it was essentially a watered down, means tested UBI. And it really should have been extended to everyone, children included, adults, because, there are LGBTQ people who are suffering, who don't have money, who don't have homes. And if they don't have kids, which, that's another barrier that, LGBTQ folks often have. Adoption is not easy. We don't have the same, means and ability to have children whenever we want. And so that's another way that, LGBTQ folks were means tested essentially out of what is essentially stimulus payments. So I 100% think that, ongoing stimulus payments is something that not only should we be working towards now, but that should have already been passed.
Well, Salem, it's been a pleasure having you on today's show. A quick look at the time shows us we've been chatting for a good nearly half hour, if not longer, and that's perfectly fine. I do hope you will take the opportunity to come back and join us as a guest again on our show.
Absolutely. Thank you so much for having me. It's been fantastic.
You're welcome. Be sure to give my greetings to the people of North Philadelphia. I can't speak on behalf of the organization, but personally speaking, yeah, I think your firebrand version of politics is exactly what the people of North Philadelphia need in Congress in their representative to Washington. So with that said, this has been another edition of Pep Talks Uncut. Thank you again to Salem Snow, candidate for Congress from Pennsylvania's 2nd District. Join us again. We're going to be off July 4th for the Independence Day holiday. We'll resume our program on July 11th, and you'll just have to stay tuned to see who our guest happens to be then. For now, thank you for tuning in, and we look forward to seeing you again soon.